Hello, folks. My name's Toby Lowe. I'm a visiting professor of public management at the Centre for Public Impact, and I help all sorts of public service organisations to find ways of managing in complex environments that enable people to produce real positive outcomes in people's lives. Thank you for inviting me to speak with you today, and I'm sorry I can't be with you in person, but hopefully I can share some thoughts with you that help illuminate the challenge that you've got around creating good outcomes for children with behavioural challenges. So the questions I'm going to respond to are, how can public service help children and families to create positive outcomes in their lives? And crucially, the question that I want to engage with is, how should public service be managed to enable that? And within that, I'm going to explore how an outcome is made. I'm going to look at the human learning systems approach to public management as a way to enable the creation of effective outcomes in complex environments. And I'm going to talk through a little about what you might do if you want to try some of this approach for yourselves. And the key message for this presentation is that if you want to achieve real outcomes, then we need to do public management very differently. And by public management, I mean how public service is planned, organised, and particularly funded. So if we want to help children with behavioural challenges to really create good outcomes in their lives, I think we need to do public management very differently. Okay, let's explore this. What's a good starting point for our conversation? And I think this is now an uncontroversial statement, right? That the purpose of public service is to help people to create good outcomes in their lives. And so if we can all agree that that's the purpose of public service, then one question naturally follows from that, which is, how is an outcome created? And the answer to this question becomes really super important, right? Because if we think that the purpose of public service is to create good outcomes in people's lives, then how the answer to this question should determine everything about how public service is managed, funded, organised, because everything should be focused on processes that enable good outcomes to be created. So this is our best representation of how an outcome is created. Some of you might recognise this. This is a systems map of the outcome of obesity produced by the Government Office for Science in 2007. It's what happens when you shut a bunch of public health people in a room together and say, you're not allowed out until you've mapped all the causes of obesity and all the relationship between all of those causes. So 108 different factors they identified leading to the outcome of obesity or its absence. So you can see them summed up in, see some of those factors summed up in things like early life experiences and food production and supply, macroeconomic drivers, education, media, technology, the nature of work, built environment. And down here in the bottom right-hand corner of this systems map, healthcare and treatment options. And what this diagram beautifully represents is that the outcome of obesity, like any outcome, the outcome of obesity is the product of this whole system of factors working together. So 108 different factors working together interdependently. So outcomes are the products of whole systems. Now, this has really, really important implications for public management, because what it means is that outcomes are not delivered by organisations. Right? This is the most important message of this whole presentation. Outcomes are not delivered by presentations. So the outcomes we desire are emergent properties of complex systems, to use a bit of technical language. So what are the implications of all of this for how we do public management? Firstly, a delivery mindset is not helpful for creating outcomes. So delivery mindset, by that I mean setting particular kind of targets where you have indicators for making sure that this happens by this kind of day. And like if you follow that particular process and kind of performance manage that hard, you will get the things you want. It is simply not how an outcome is made. So a delivery mindset is not helpful for creating outcomes, because you can't contract an organisation and program to deliver an outcome. And contracting and performance management, we know what happens if you try and contract or performance management for outcomes. So if you try and have outcomes-based contracting, right? What it's doing is holding people accountable for things they don't control. Let's can see the proof of this from this diagram, right? Down here in this systems map of obesity, you've got 4 factors out of 108 that are healthcare and treatment options, right? So these are the things that commissioners would tend to commission to address the outcome of obesity, right? So there might be a number of gastric band operations provided, done by hospitals, or it might be healthy eating programs undertaken in neighbourhoods, right? These are things that governments of local or national thing can commission. What happens if you hold these organisations in this part of the system accountable for delivering outcomes? Well, you're holding them accountable for the behaviour of the system as a whole. So you're holding people who are delivering healthy eating programs in neighbourhoods accountable for how kids' early life experiences work, or the nature of food production and supply, right? Which is, and holding people accountable for things they don't control is nonsense. And we know exactly what happens from the evidence around what happens when outcome-based contracting is undertaken. All that doing outcome-based contracting creates is gaming. So it turns everyone's job into the production of good-looking data rather than doing the job at hand. And then what it means is that those systems can't learn effectively because no one can trust the data that's sloshing around in those systems. So if organizations want to help people to create real outcomes, what is it they should do? Well, what we found is that embracing the complex reality of how outcomes are made is the starting point for really supporting outcomes in people's lives. So what it requires is for managers of all and leaders of all stripes to let go of this managerial fantasy that we've developed over the last kind of 15 or 20 years, that the linear causal logic of if we do a process A well enough and hard enough and robustly enough and standardized enough, then it will lead to outcome B. It's not true. What we need to do is to open the door to the complex reality of how the world actually works and respond with our management to approaches to that complex reality, rather than living in this kind of cozy managerial fantasy that we've been encouraged to live in for the previous 15 or 20 years. So this is what the human learning systems approach is about, helping managers and leaders in all forms of public service to embrace and create a public service for the real world, rather than the managerial fantasies that we've lived in previously. And the key principles of human learning systems are the human bit is about bespoke public service. So what public service needs to do is to understand and respond to the strengths and needs of each and every person. Secondly, learning is the management strategy which enables public service to respond to that complex reality. And finally, systems bit, healthy systems are what create good outcomes. So the primary role of leaders is to create and maintain the conditions for collaborative learning at all system scales. So let's explore each of these in turn. Human. So what a human public service looks like is bespoke for each individual or family or community and built on effective human relationships. So let's dig in. What do we mean by that? So let's dig into this question. How is a desirable outcome created in each person's life? Because what we see is that each person's life is a unique, complex system that creates outcomes. So again, thinking back to that obesity diagram and all the different kind of areas of factors that affect the outcome of obesity, early life experiences, for example. My early life experiences are different to your early life experiences. The built environment around me is different to your built environment. So my life has a unique, complex system that creates the outcome of obesity or its absence is different to yours. And this is a way to represent the idea that each person's life is a unique, complex system that can produce desirable outcomes, or it can produce undesirable outcomes. And we can see that each person's life it can be seen as a layers of different complex systems. So starting with the microsystem around them, their family, their peers, their religion, their GP, blah, 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 right? That's a microsystem. Again, unique to each and every person, because my family is different to your family. My peers are different to your peers, blah, 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 right? And then going out through kind of meso and exosystems, like the local amenities in a place, the health resources in a particular place, right? This is a system, a layer of a system that creates, helps create an outcome in someone's life. And then out through to kind of macro systems, the economic structure, the culture, the ideologies, the laws in the place that people live. So this is ecological systems theory from the world of psychology. It represents these different layers of systems that all center around each person's unique life as a complex system that produces outcomes. And so how can public service respond to that idea that each person's life is a unique complex system that is the means by which outcomes are created? And let's say what we see is this idea of learning as a management strategy. And learning as a management strategy starts by framing the work of public-facing workers in this through this kind of learning cycle approach. So, let's say I'm a worker whose job is to help you as a person who's experiencing the outcome of chronic pain in your life. My first job is to help build an understanding of your life as a system that's currently producing the outcome of chronic pain that you and I share. So I might ask you questions like, do you experience the pain more in the morning or the evenings? Do you experience it when you're at work or at home? Do you experience it when you make these kind of actions or these kind of actions? Do you experience it when you eat these kind of foods or these kind of foods? Together, we build up a picture of your life as a complex system that is currently producing the outcome of chronic pain. And then when we've got a good enough kind of collective understanding of that, then you and I can co-design experiments and explorations to try and get your life to produce a different pattern of results, a different outcome, right? So what experiments might we design together? What could we try to disrupt the existing patterns of your life as a complex system and help it to produce different? We could try seeing what happens if you join a walking group. We could try seeing what happens if we fit this enablement equipment to your house. We could try see what happens when do this kind of physiotherapy manipulations and techniques. Try what happens if you try this diet rather than that diet, right? We can design all of those as experiments. And then we run those experiments. So we turn public service into action research, right? So each intervention in each person's life is action research. And then from the results of all of those bits of action research, we embed an influence to change the pattern of your life. So we can create a behavioural change in your life and structural change in the forces around your life. And in doing so, we change your life as a system. And so the cycle begins again. And so this is how public-facing work framed as a learning cycle. So the job of public-facing workers framed as learning cycles enables the bespoke public service response that allows the creation of outcomes in each and every person's life. So question for you, what would bespoke public service look like for children with behavioural challenges? How are you going to frame the work of all the public-facing workers involved so that they can understand the unique life of each and every person that is experiencing this, the families involved, the children themselves, understand how that those behavioural challenges have come to be, how they manifest, what are the kind of who are the important actors in producing that that particular outcome? Who are the important actors involved in enabling to change that? How can all of those actors learn together about and form collective knowledge about why it is that that person is experiencing behavioural challenges? And then once they have that, all those actors have that shared understanding of all those factors that create these undesirable outcomes. What experiments are you going to collectively design to see whether we can get those children and families' lives to produce different outcomes? And then designing those as proper action research, right? Data to be collected, who's going to make sense of it, all that kind of stuff. When you run those, what do you learn from that? What is each person's life? How is each person's life becoming different through the different experiments and explorations that you undertake? And then from what you learn, how are you going to embed those changes as behavioural and structural changes around that person's life, right? This would be, I would suggest, the key management task that you face in your context. How will you enable this work to happen in this way? So let's explore further this idea of learning as a management strategy. So what we've seen is that learning as a management strategy happens at all sorts of different system scales. So we explore what it looks like at that kind of person practitioner system scale. But as we saw from the ecological systems theory, there are lots of different layers of systems around people, right? So the person's life is a system, teams that support that person are systems, the organization that employs those teams are systems, the places that have lots of organizations in them are systems, and the country has lots of places in it. That functions as a system, right? And at each of these system scales, the same kind of learning cycle is undertaken. That's what we found in order to embed learning as a management strategy that genuinely enables public service to respond to the kind of complex challenges of the reality of people's lives. So whatever layer of management or responsibility that you have, whether it's kind of just as a team leader or up through to responsibility for an entire place, your primary role is to run these kind of learning cycles. Because what we see is that the learning cycles from the public-facing workers, right? So there's tons of these happening, right? For each child or each family, there's at least one learning cycle happening, right? And what this constant process of experimentation is doing is it's throwing up challenges to business as usual for the organizations that employ the workers who are doing that work with them, right? That constant experimentation, the constant responding to the uniqueness of each person's life is throwing up challenges to how the work is organized and planned. And the human learning systems response is to say, okay, we need to understand the patterns in all of these challenges to business as usual from all of the experiments on the ground. And at team leader and at organizational leader and at place leader, I think, your job is to create a learning cycle at that scale, which takes all of those questions and challenges coming up from the ground and says, what should we do about those? I am really curious about what we should do to the challenges that the work is throwing up. So it might throw challenges like, what are the maximum caseloads for workers? What information systems do we need to help the workers and the families reflect together on what's being found? What shared reflective practice spaces do we need to create to enable all these people to make sense of what's going on here? What staff capabilities do we need to recruit and train for in order to help them frame their workers' learning cycles in this way? This is the likely content of the learning cycles at team scale, at organizational scale, at place scale, etc. Right? And the experiments that you design and run at this team and organization, whatever scale, that creates the enabling conditions for the workers who are doing the public-facing work. So, constant challenges to business as usual, responded to by continuous learning at the management scale. And so what the human learning systems approach and learning as a management strategy looks like when enacted fully is this kind of connected stack of learning cycles from the public-facing worker right the way through up to the minister. And that we're working in different contexts to enable those learning stacks to go right from that public-facing work right through up through the decision-making layers. Human learning systems. So this idea that we know that it is these complex systems that are the means by which outcomes are created. So the response to that and at a systems level is creating this role of systems stewardship. So we parlay the role of leadership into systems stewardship, which is the process of managing and governing these interconnected learning cycles. So we want to one of the things that a human learning systems approach does is kind of reframe traditional tasks of leadership as this kind of system stewardship. So the role of leaders is to create, manage, and govern these learning cycles across different system scales. And this requires a really kind of significant commitment from you as leaders. It requires a commitment to curiosity across leadership teams, because when your business as usual is challenged, what it requires is a commitment to that really difficult thing to go, rather than being defensive about your business as usual, to go, oh, that's really interesting. How do we need to change in response to that? It means changing the focus of management roles so that the primary task of management is organizing the learning cycles and undertaking all the work as action research. It means being a learning role model, so creating and running your own learning cycle so everybody learns, right? Including chief executives. It means building the capacity or the capability to do this stuff within all of your organizations. And significantly, it means bravery, because you as a leader will be required to say, the way that these things are being done right now does not work, and we are going to carve out space and time to make sure that they work differently, because otherwise we'll just be continuing to throw good money after bad. So digging into this idea of creating healthy systems, what do we know about the characteristics of healthy systems? What are you trying to create as system stewards? Well, we know that healthy systems are learning systems. So how are you going to enable people to collaborate and learn together? We know that healthy systems cultivate and make use of trust. So how are you going to enable relationships of trust to be built between all the actors in the systems that you identify at whatever scale you're working at? We know that healthy systems are diverse systems. So these kind of learning systems don't function when people are systematically excluded from having their voice heard as part of these learning processes. So how are you checking that everyone who needs to be included is included? And particularly to do that, healthy systems address inequalities of power, because you're never going to be able to include people in learning processes who are systematically marginalized and kept at the edges. So you're looking to manage and govern learning cycles to ensure that they display these kind of characteristics. In terms of kind of direct tips from what we've seen from people who've enacted this kind of approach, it means stopping doing a bunch of things that about how public management works right now. So it means stopping doing the things that undermine trust and collective learning, like competitive tendering, because the evidence says that competitive tendering destroys kind of trust and ability to collaboratively learn. So if the evidence says that competitive tendering prevents that happening, stop doing it. It means an end to target-based performance management. Again, because the evidence says that target-based performance management prevents organizations from learning effectively. I mean, it also does a bunch of other things like drive up costs and reduce effectiveness of public service massively, what the evidence says. So stop doing that. And stop creating predefined service specifications, because you can't respond to the variety of each person's life as a complex system if what you're saying in your service specifications is you must do this, 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 and this. When you write a service specification, you cannot know how you will respond to the variety of every person's life as a complex system. So stop doing that. Yeah, this is just what we've seen from organizations and places that have tried this approach. And kind of the nice thing about this is all evidence supported. So if you care about evidence informed practice around this is what the evidence says about how public management works, doesn't work right now, and what you can do to change all of that stuff. So, and the crucial thing really around this is making the money behave different. So in your system, you need to make sure that the resources flow, money flows for continuous learning. So what people are funded to do is continuously learn to meet the strengths and needs of each and every person. So that kind of purpose stuff is really important, meeting the strengths and needs of each and every person. But the way that happens is that all the resources flow, all the kind of financial incentives flow for that continuous learning and adaptation, because that's how outcomes are made. Right? And whilst resources in your system flow for in respect of other things like other targets or whatever, you will not really be able to create these effective learning systems. You'll not really be able to create real outcomes. So if you want to try this for yourselves, we've been working with the Scottish Government and Healthcare Improvement Scotland to create what we call a practical guide for the curious for organisations and places that want to try this. So you can download the guide, and hopefully that will give you a decent sense of how to start off on some of these journeys if you want to. When you do download it, we ask for your details so that we can capture feedback from you, because this is just version 1 of this guide. We want to understand how people are using it in practice and what bits are useful and what bits are not and what bits missing, so that we can continually improve it. And also, if you need help with any of this stuff, because changing some of this stuff can be really hard, then you can ask some of my colleagues at Centre for Public Impact Europe for help on that. And then there's a web address there you can ask for help. So there's also more information on the Human Learning Systems website, so humanlearning.systems. So there's a ton of videos of these kind of presentations and case studies from there's over 50 case studies of organizations that have put it into practice around the world, so you can see concrete examples of how it's all worked. So in summary, Human Learning Systems approach is a whole different approach to public management. It starts with the reality of how outcomes are made. So we think it's public service for the real world. And what it really boils down to is learning is the management strategy for your organizations. So if you have any management responsibility, your primary task is to create learning environments. And you can apply this strategy at all system scales, at person scale, organization scale, place, country, or region. And making these kind of changes is hard graft, because what you're essentially doing is you're creating an alternative part of the world where a different logic applies. So I'm going to create a bit of the world where different rules apply. That's what it is you're trying to do. But the payoff for that hard graft is better outcomes for less money. That's what we've seen when people have enacted this. What they get better, it's that kind of holy grail, better outcomes, less money. And what it really comes down to is happier people. Happier citizens, because they're getting their needs met first time, because they're getting the bespoke responses that are right for them, and happier staff, because they're getting to do the things that they joined public service to do. Thanks very much. Hope that's been some kind of useful or interesting.